Assalamualaikum and hello everyone. I'm Faiza, pharmacy student from University Brunei Darussalam. Meet Sam.
Hello.
He just had his surgery last week to replace his heart valve. After his surgery, the doctor gave Sam a medicine called Warfarin. Sam never used Warfarin before. Today we will be helping Sam get to know about his Warfarin treatment. Every Warfarin patient will be given this pink card. It will include all necessary information about your Warfarin treatment. Let's start with what is Warfarin. Warfarin is an anticoagulant which helps prevent harmful blood clots from developing inside your body. The brand name is Coumadin. Warfarin, also commonly known as blood thinner.
What is blood clots?
When we get injured, blood clots help stop the bleeding through a process called hemostasis. Then, blood clots will usually go away or dissolve once the body has healed. We can say that blood clots are healthy and life-saving when they stop bleeding because they prevent excessive blood loss. However, blood clots can be dangerous when they do not dissolve and form in a blood vessel. These blood clots can block the blood vessel, preventing oxygen from reaching your organs. The blood clots can also travel and block other parts of blood vessel. When blood clots travel to the brain, it can cause stroke. If blood clots travel to the heart, it can cause heart attack.
Why do I need to take Warfarin?
Some people are at higher risk of developing dangerous blood clot. Therefore, they will be given Warfarin by their doctor. People with replaced heart valve, just like Sam, or someone who have irregular rapid heartbeat, will take Warfarin to prevent development of harmful blood clots. Others may take Warfarin because of blood clots in their legs or in their lungs.
How can Warfarin help me and other patients?
Warfarin works by slowing down the time for the body to form blood clots. Warfarin also helps prevent blood clots from getting larger.
How long do I need to take Warfarin?
Some people have to take Warfarin for the rest of their lives, while others may be on it for a short period of time, such as 6 weeks to 12 months. It will depend on each individual condition. Your doctor will decide on the duration of your treatment. Warfarin tablets are color-coded based on their strength. Strength or their dose is measured in milligrams, and each tablet has a different color.
Why do I need to do regular blood tests?
You need regular blood tests to see if the Warfarin is working or not. The blood test can be done by taking a blood sample from a vein or from a fingertip. The blood test is called International Normalized Ratio or INR. INR measures the time for your blood to clot. With regular blood tests, your doctor will be able to determine and give the most suitable dose for you. Therefore, it is important to ensure that you do not miss your appointments. Every person has different target INR. A target INR range between 2 and 3 provides the best balance between the chances of bleeding and clotting. If your INR is lower than your target, it indicates that you are taking too little Warfarin and you are at increased risk of blood clot. If your INR is above your target, it means that you are taking too much of Warfarin and you are at increased risk of bleeding.
What are the side effects of Warfarin?
When taking Warfarin, you will bruise easily and bleeding will take longer to stop, but the bleeding should stop when pressure is applied. Other common side effects may include rashes, nausea and vomiting, abdominal pain, and diarrhea. Always remember and watch out for these warning signs. Go to the emergency department when you experience any of the following signs, such as prolonged nosebleeds, which last longer than 10 minutes, blood in your vomit or when you cough, blood in your urine or stools, severe or unexplained bruising, severe gum bleeding, severe headache, heavy or increased bleeding during your period for women. These signs indicate that your INR is too high and you need an urgent INR test.
How should I take my warfarin tablets?
Always know your dose before leaving the hospital. This is because your doctor may change the dose of your warfarin during your appointment. Read instructions carefully each time before taking warfarin. It is advisable to take warfarin at the same time of each day, preferably in the evening at around 6 p.m. If you forget to take warfarin before midnight, you can still take the dose. If you only remember past midnight, do not take the dose. Keep a record of any missed doses and tell your pharmacist. Do not double your warfarin dose to account for your missed dose. It is very important to avoid missing doses of warfarin. Record on your calendar or diary each time you have taken warfarin. This is to remind yourself that you have taken warfarin that day. Warfarin can be taken with or without food. Warfarin is affected by the amount of vitamin K in your diet. Too much vitamin K intake can decrease your INR. Therefore, it is important to have consistent intake of vitamin K in your diet. Green leafy vegetables such as broccoli, cabbage, spinach, green tea contain high amount of vitamin K. You do not need to avoid these foods, but you should aim to keep the intake fairly constant. It is important to avoid sudden changes in your eating habits and diet. Herbal and vitamin supplements may interact with warfarin. They may increase or decrease the effects of warfarin. It is very important to inform doctor or pharmacist if you are taking any herbal or vitamin supplements. If you need dental treatment, always tell your dentist that you are on warfarin. It is advisable to bring your warfarin card for your referral. If you take warfarin, it is best to avoid rough exercises or activities to avoid getting any physical injuries, especially if it causes bleeding or bruising. Remember to inform your doctor if you have made plans to travel. Always ensure that you take enough warfarin tablets with you to last the entire trip. If you suffer a minor bleeding injury, wash and apply pressure to the wound until bleeding stops. If the bleeding occurs without stopping, go to the emergency department and seek medical help. For women, avoid getting pregnant without first discussing with your doctor if you are taking warfarin. Remember that warfarin medicine is given for you only. Please do not share with others. Always contact your doctor or pharmacist if you have any additional questions. Now, Sam already understands about his warfarin treatment and ready for his warfarin journey. How about you?
Yay! Thank you for helping me.
Before we end the video, I have 3 questions for you to answer. You can pause the video and select your answer. First question. What blood test is used to check whether your warfarin dose is safe and working? A. Blood glucose test. B. International Normalized Ratio or INR. You can pause the video and choose your answer. The answer is B. INR is a number that measures the time for your blood to clot. Your target INR will depend on your conditions. Ask your doctor or pharmacist to know your target INR. Second question. When is the best time to take warfarin dose? A. Around 6 p.m. in the evening. B. Any time of the day. You can pause the video and choose your answer. The answer is A. It is best to take your warfarin in the evening around 6 p.m. This is so that if you need to change dose after a blood test in the morning, you can take your new dose on the same day rather than on the next day. Third question. What you should do if you forget to take warfarin at 6 p.m. and remember at 10 p.m. A. Take Warfarin at 10 p.m. B. Do not take Warfarin as it is already past 6 p.m. You can pause the video and choose your answer. The answer is A. If you forget to take a dose of Warfarin before midnight, in this case 10 p.m., you can still take the dose. If you only remember the next day, you can skip the missed dose and just take your next dose as normal. That's the end of this video. Thank you for watching until the end. Hope this video can help you get to know more about Warfarin.